stomach bleeding, brain hemorrhage, minor strokes after medication, fatigue, dizziness, rapid heartbeat. These are adverse effects of taking daily aspirin after the age of 60, not signs of an illness. In the United States, thousands of elderly people continue to hold the belief that one aspirin a day protects the heart. In actuality, however, your liver breaks down drugs more slowly, your stomach lining deteriorates, and your blood arteries narrow as you age. Anemia, fatigue, or even unexpected death can result from silent internal bleeding caused by even one little medication used daily. So beyond age 60, should you continue taking aspirin every day? I'll tell you the reality that few people discuss. There are times when aspirin helps and others when it hurts without anyone noticing. This video could save your life or the life of someone you care about. So subscribe to Bon Elderly Wisdom. Aspirin was regarded as the golden shield against heart attacks and strokes for many years. To thin the blood and avoid fatal clots, doctors advise middle-aged adults to take a tiny medication every day. However, recent studies have shown that the body no longer reacts to aspirin in the same manner after the age of 60. Your liver and kidneys slow down as you age, your stomach lining weakens, and your blood vessels become more delicate. This implies that aspirin, which prevents clotting, can now cause excessive bleeding, particularly in the brain or stomach. Tens of thousands of elderly patients are admitted to hospitals each year due to bleeding in the brain or gastrointestinal tract caused by regular aspirin use, according to the American Heart Association. Worse yet, many people keep taking it because they are scared that discontinuing it may result in a stroke, even though it may be causing gradual internal bleeding every day. Aspirin is not harmful. It's effective, but only for those who are in dire need and only with a doctor's guidance. If you're taking it because everyone says it's good, now is the time to stop and consider your options before your body alerts you with an irreversible symptom. The first answer is straightforward. Never begin or discontinue taking aspirin without first consulting your physician. Your heart is more sensitive, your arteries are more delicate, and your blood clotting behavior has changed. Your body is not the same at 60 as it was at 40. For this reason, a dosage that is right for one individual may be harmful to another. To determine your true cardiovascular risk, consult your physician. Do you have diabetes, high blood pressure, a history of stroke, or plaque accumulation in your arteries? Aspirin is only required as a precaution if you are in the high-risk category for heart disease. However, taking aspirin every day may do more harm than good if you're generally healthy and don't have any serious underlying medical concerns. You could avoid years of quiet internal bleeding with a 15-minute consultation. Don't allow a small pill determine your heart's destiny. There are safer, natural alternatives to using aspirin if you want to protect your heart and avoid stroke. The second option is to use nutrition to control the viscosity of your blood. Without the risk of bleeding associated with the medication, some foods function as natural, modest blood thinners, increasing circulation and decreasing the formation of clots. Salmon, avocado, chia seeds, garlic, ginger, and extra virgin olive oil all support healthy blood flow, blood pressure regulation, and vascular inflammation reduction. Reducing your intake of fried foods, limiting red meat, and drinking warm water on a regular basis might also help your heart feel less stressed. Your body can automatically balance circulation and clotting with a diet high in leafy greens and healthy fats, so you won't need to take aspirin every day. Food itself becomes the most potent heart medication when it is chosen carefully. Your own two legs contain the finest means of maintaining healthy blood flow, not a medication. To avoid blood clots, the third option is to maintain a moderate level of physical activity each day. You can maintain your heart pumping steadily and prevent blood from stagnating by simply stretching gently in the morning, taking deep breaths, or walking for 15 to 30 minutes after meals. According to studies, Seniors who walk on a regular basis are 30 to 40% less likely to have a heart attack or stroke than those who don't. Consistency is more important than intensity. Your blood is refreshed, oxygen is sent to your heart and brain, and your mind feels lighter and more at ease after moving. The safest and most efficient natural aspirin is found in a body that moves every day. Your arteries will continue to deteriorate over time regardless of how well you eat or exercise if your blood pressure and stress levels are out of control. The fourth option is to naturally reduce stress and maintain stable blood pressure. Your body produces cortisol and adrenaline when you're nervous, which constrict blood vessels and quicken your heartbeat, raising the possibility of a clot forming. Aspirin ceases to function as a heart protector in that condition and instead acts as a bleeding trigger. Develop easy habits. Take 5 slow, deep breaths before bed, listen to relaxing music, or meditate for 10 minutes every morning. These simple practices can naturally calm your heartbeat, relax your arteries, drop blood pressure, and lessen inflammation. Any medication is never as effective as a quiet heart. Lastly, getting regular health exams, particularly blood testing, is the fifth and most crucial remedy. Your doctor may assess your genuine cardiovascular risk, liver and kidney function, and blood clotting capabilities with a single easy test. Daily aspirin might cause severe bleeding if your blood is too thin. If it is too thick, your doctor might suggest a much lower dosage or a safer substitute. Guesswork should never be the basis for heart treatment. Every year your body changes, so what was healthy at 50 might not be safe at 65. You may take charge of your heart health by getting tested twice a year, rather than depending on out-of-date recommendations. Being healthy is about genuinely knowing your own body, not about accepting what other people think. Your body changes beyond age 60. Every tablet needs to be carefully chosen because your heart is weaker and your blood vessels are more fragile. Once a hero, aspirin should now only be taken under strict medical supervision. Protect your heart with a nutritious diet, frequent checkups, gentle movement, and a quiet mind instead of relying on medicine. You can avoid quiet consequences that aspirin alone cannot avoid by adopting these simple practices. Don't miss the daily natural tips that help keep your heart safe by subscribing to Bon Elderly Wisdom. Tell me, are you still taking aspirin every day? Leave a comment below with your opinions.